Hello and welcome to Junior Achievement's virtual speaker series. Today we're going to be talking about careers within the healthcare industry, and I have the pleasure of being joined today by Dr. Janice Victor. Dr. Victor, how are you?
I'm doing well today, thank you.
It's wonderful to see you. Thank you so much for joining us. Okay. And I would first like to ask you, what did you do coming out of high school? What was your major?
My major, first of all, was college. My major in college was biology, coming out of medical school. I'm coming out of high school rather, and but you don't have to be a science major to become a doctor. You can be any major and take science classes to become a doctor.
Okay, and how many years do you have to go to school?
Well, starting from high school, let's talk after you graduate from high school. After that, it's 4 years of college and then 4 years of medical school. In between that time, you take tests to get into medical school.
And how did you know this was what you wanted to do?
I know that I wanted to be a doctor because, like any other career, you should choose what you enjoy doing. I like science. I like people. They came together. A scientist who likes people is a doctor.
Okay. And what do you currently do now?
Currently, my field in medicine is called anesthesiology. For those of you who don't know, when a patient goes through the operating room, there's a surgeon and there's an anesthesiologist. There's two doctors in the room. So I'm the doctor that puts patients to sleep, takes care of them while they're sleeping, and wakes them up.
Okay. And from, up until this moment when you're doing what you do, what other things have you done within the medical profession?
Within the medical profession, I've done quite a few things. Within the medical profession, I worked after college at an organization that gave healthcare to women who were having babies. I also did volunteer work with students, high school students, teaching them how to become doctors and how to become healthcare professionals. There's a specialty called biomedical engineering that I also work with, and how to develop medical products so that people can use, like bionic arms and robotic arms.
That's amazing. And I know you're still continuing your education. Can you talk a little bit about that?
Yes. So after my educational process was, high school was 4 years, college was 4 years. I applied to medical school. I got in. That was 4 more years. I applied to become an anesthesiologist. That was 4 more years. Mm-hmm. Then I decided to do a second specialty in interventional pain medicine. That's 1 more year. So I did that for about 15 years. And I decided, I actually own my own business, my own practice, and see patients. So I need some business understanding. So I went back to get a master's of business administration, and I'm graduating in 3 months with an MBA.
Congratulations.
Thank you.
So what advice would you give to students who are interested in entering the healthcare industry?
The advice I would give students is the advice that I give anyone for any industry they're interested in. Do something that you enjoy. That's the first piece of advice. The second thing is do something that you're willing to work hard and learn, because you don't know it yet. You don't know enough yet. So do something that you're interested in and willing to learn at. And then after you figure out what that is, then go online and find out, one, what the courses are to become that, the certifications, the length of time, the environment. Look for videos for people who actually do that. And ask someone who does that, can you shadow them and find out what they do on a day-to-day basis for a couple hours?
Wonderful. That's wonderful. And we didn't talk about the favorite thing about what you do, being a doctor.
Yeah. Everything what I do becoming a doctor is seeing patients. I like seeing patients. I like helping them get better. So I see patients, I interview them for surgery, and I take them to surgery. I take care of them in surgery. I wake them up and they're better. So whatever the ailment was that caused them to have surgery, it's gone and they're doing fine at that point. So that's my favorite part.
That's wonderful. So if we had middle school students or high school students currently watching who are thinking, well, what can I do now? If I know I know I want to be a doctor of some sort, what could I start working on in middle school or high school to help me with that career pathway?
Perfect. The thing you can do is your sciences and your math classes. You can make sure that you maximize the time in them and learn as much as you can in your sciences and your math classes. Okay, there are health science there are classes called health sciences, which include classes about health and physical education, health, and those kind of classes. Learn as much as you can. The next thing you can do is you can find a physician, the one that you go to, a pediatrician or whoever you see, and ask them, can I spend a couple hours with you learning what you do? And ask them questions. make a list of questions on the index cards and ask them questions like, what time does your day begin? What times do they end? What's your favorite part of doing things? Well, how long did you study? How, what do you like? What don't you like? And they'll answer for you.
And I think another key thing, there's so many professions within this industry. You have to research and, like you said, match your interest to what you want to do, because you have to love what you do.
Correct. There's doctors who take care of eyes. They're called ophthalmologists. Who deliver babies. They're called gynecologists and obstetricians. There are people who look at x-rays. They're called radiologists. There are people who take care of kids. They're called pediatricians. So there's a large amount of specialties within medicine in itself.
Well, this is wonderful, Dr. Victor. Thank you so much for this this time you spent with us. I know you're very busy, so I really do appreciate it.
You're welcome. But my last piece of advice is that whatever you want to do, study hard, and you can do it because I believe in you. Good luck.
Thank you. Absolutely true. Thank you.